Good afternoon. I want to welcome you to our Monday press briefing with updates on COVID-19. As of this morning, we've lost almost 80 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell.
Thank you, Chief. 3 topics I want to talk on today. Only one of them is new. The first issue, the coroner has expressed frustration that funeral homes and grieving families continue to fail to observe the directive that no more than 10 people should congregate at one time. It has been discussed in the task force meetings, and please be aware that if law enforcement is providing escort services to any funeral service, police officers or sheriff's deputies will be authorized to issue citations and to enforce the limit of no more than 10 people at any gathering, whether it's at graveside, a funeral home, or in a church. Now, the other 2 issues I want to address have to do with statistics. I don't think Dr. Ruiz will be here with us today. He has, in the last few weeks, graciously devoted an inordinate amount of time to the situation we have here in Albany and Dougherty County. As of this week, in the district, they are opening up 2 new testing sites, one in Thomas County, one in Miller County. If I can show you a map of Georgia, it's on the Department of Public Health website. This is an excellent resource. I'd encourage anyone at home to access this information. They have daily updates. But what this map shows us is that whereas only 2 weeks ago Albany was a hot spot for COVID-19, now all of Southwest Georgia has that same problem. Today, according to the Department of Public Health website, and the coroner is going to have more update figures, Dougherty County has 1,217 citizens who have tested positive for the virus. That is second behind only Fulton County. 77 Dougherty County residents have lost their lives. That is the most in the state. To put this in perspective, Fulton County has about 8 times the population of Dougherty County. But as this map shows us, the toll is no longer concentrated in Albany and Dougherty County. The figures, according to the Department of Public Health website for Lee County, 252 people have the virus, 15 deaths. Mitchell County, 147 people have the virus, 15 deaths. Terrell County, 114 residents have the virus, 10 deaths. Worth County, 90 citizens have the virus, 4 deaths. Calhoun County, 48 citizens have the virus, 2 deaths. Baker County, 16 citizens have tested positive, 2 deaths. And we know from our experience here in Albany from weeks ago, the number of positives in these surrounding counties, particularly Terrell, Calhoun, and Baker, are probably substantially higher than these numbers. Also on the website, there's information. The most recent number is 13,305 Georgians have tested positive for the virus. Of that number, approximately 19.5% required hospitalization. What does this tell us? Over 80% of the individuals who have the virus don't require hospitalization. These individuals are out in the community. They have to self-isolate, they have to quarantine, because otherwise they are going to continue to infect others. The death rate in Georgia, the total is 462 deaths. That's 3.5% of the people who have the virus, who've tested positive for the virus, have succumbed to the virus. Another thing I want to point your attention to on the Department of Public Health website is this. There is a list of the number of victims who had underlying underlying medical problems. Overwhelming number of those individuals had underlying health care problems. So, what we have to do is remain apart from loved ones who have the underlying health care conditions, and I also implore those who have underlying health care conditions to exercise extreme precautions, because the research tells us, the medical professionals tell us, and experience tells us that these people are the most vulnerable to the virus. Thank you.
Thank you, Mr. Mayor, for your comments today. I'd now like to bring up Dougherty County Commission Chair, Mr. Christopher Cohilas, for some comments. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. I trust that everyone had a wonderful Easter yesterday and a happy Easter, that everyone was able to spend time with their families and their family units and at home. And we know when we recognize and understand that this is not the traditional way that many of us spend Easter, but it's a new normal that we're all having to learn through, and we can continue to build bonds and connections with each other in new and different ways. Again, my heartfelt sympathies to each of the families that have lost family members. 77 lives is a tremendous number of lives. And not just to the Dougherty County citizens, but to the citizens of Terrell County, Lee County, Baker County, all of our surrounding counties that have lost lives as the COVID-19 virus continues to proliferate, not just Albany, but all of the surrounding areas around us. I want to reiterate the governor's order was the extended governor's order was released on last Monday. And he extended the shelter-in-place order through April 30th and the emergency declaration through May 13th. And I've gotten a lot of questions about what his shelter-in-place order means. And in fact, this morning was on an advisory committee phone conference with other county commissioners that are helping advise the governor on different trends across the state relative to the coronavirus. And one of the questions that has popped up and that we're trying to define for people is, what does it mean truly to shelter in place? Because one of the trends that we're seeing across the state is that some people are traveling from their home to spend time with other people or stay with other people throughout the state. And I want to be very clear. The governor's order is very clear. Shelter in place means to shelter in your residence where you live, where your family lives, not with a visitor out of the county, not with at a vacation home with another couple. It means to shelter in place. And there's a reason for that. The reason for that is there's been a dedicated response to trying to make sure that everyone stays in their respective bubble. And that's very important so that you can limit your interaction with other people, so that germs don't get passed from community to community, and so that we can overall slow the spread of the virus and not just think in terms of my neighborhood, my room, my community, my county, my city, but as a region and as a state. And it's easiest to do that, to shelter in place in your home where you know your family is safe, where you can control the cleaning, the disinfecting, and you can make sure that you can connect with family members through technology and other ways, many other ways that are possible. Today, the governor will hold a press briefing at 4 p.m. It will be broadcast on GPB to address the 200 COVID-19 beds that are coming to the Georgia World Congress Center. Other updates at his press conference today will come from GEMA, the Georgia Department of Community Health, and the Georgia National Guard. Everyone can tune in to gpb.org/coronavirus. In Albany and Daugherty County, I want to say this. The citizens have been working very hard, and I recognize, and I always say this, you got some folks that are going to follow the rules, they're going to shelter in place, they're going to shelter in their residence, they're going to limit their activities to what is essential business activities, and then you have some folks that are doing, frankly, knucklehead stuff. And we see those pictures on Facebook where people are having large barbecues and they're congregating. That's happening. That needs to stop. And the police and the sheriff's department are doing a great job of enforcing that. And I urge the citizens to continue to call into our emergency operations center to make sure that people who are not following social distancing or not following the governor's order are reported, because it is irresponsible to not do that. But the vast majority of our citizens are doing what they're supposed to do. And I'm also very thankful to see, in response to my request and many other requests, we're seeing in a lot of our large stores additional implementation of safety measures that is better for the citizens, better for the people. And frankly, that is not in many of the communities that are surrounding us. You're seeing, I went to Publix the other day, and they have set up one-way aisle systems so that people can move through in an orderly fashion, maintain social distancing. Was also happy to see the large number of people that were wearing masks. We know from the CDC that masks are effective in preventing the transmission and perhaps the receiving of the virus. Those are good things. The more we educate our community, the more steps we put in affirmatively, means the faster that we can flatten the curve. And we're already seeing some signs of that. And I'm very encouraged by that. We have to continue to be strong, be vigilant, be disciplined, and shelter in place at your home. As a reminder to everyone, the governor's order supersedes all local orders that we've issued. I've gotten a lot of questions from a lot of people. Some people expressing frustration about this thing or that thing. It's no longer our call. The governor has issued an order. It applies to the entire state. We have given our recommendations through the Georgia Municipal Association, or the Association of County Commissioners of Georgia, to the governor. I serve on an advisory committee there. We make the governor's office aware of the trends that are here, and we get information. We receive, as a result of that, we receive some updated information relative to his directives as it relates to funerals. And again, what I will say is this. You can view this as a problem where you can do the bare minimum or precisely what the governor says. Or you can be part of the solution and exercise best practices above and beyond the floor that the governor has set. We can do things like just don't go to gatherings unless it's absolutely necessary. And understand this, like there's inherent risk in going to a funeral that involves someone that unfortunately and tragically has passed away from the coronavirus. Necessarily, that person likely had contact with other folks. And those folks are likely at that funeral. And so it's very important. I mean, it's such a tragic and horrible disease, and it's horrible to imagine that the mourning process itself is disrupted by how horrible this virus is. But these are the things we have to recognize, and we have to get outside of our emotions to logically approach those things. And we can mourn the loss of any person in a special and private way. And it doesn't always have to be, with a bunch of folks gathering together and hugging and doing that in the traditional way that we often do in the South. And I would just say, please be mindful of those things. I want to reiterate again, our Emergency Operations Center is, as always, is in full swing 7 days a week from 8 a.m. to 5 p.m. Again, unless you have a true emergency, please do not call 911. Please call our EOC at 229-302-1900 and let them provide you with the resources you need as it relates to the coronavirus. Thank you, and God bless.
Thank you, Mr. Chairman, for your comments. Now we'll hear from the Chairman of the Lee County Board of Commissioners, Mr. Billy Mathis. Mr. Mathis.
Thank you, Chief. I'd like to offer my condolences for the families that have lost loved ones in Lee and Daugherty and the surrounding areas. I don't attend all of these press briefings. I only attend when I think I can offer something, and today I want to offer a little bit of good news for the Lee County community. We have held steady in the number of deaths for the past week at 15. Now, as I've said before, one is too many, but we've held steady at that number. That's a good trend. For the most part, Lee County citizens have done their jobs in social distancing and doing all those things that we've asked them to do. I don't offer this bit of good news to have people relax what they're doing. I offer this bit of good news to ask you to continue doing what you've been doing, and as Chairman Cohilas says, do a bit more. Do your part. Do whatever you can do to let's get this behind us. Some other Lee County announcements. Lee County volunteers tomorrow will continue with the food bank operation. I believe that starts at 10 a.m. in the morning. It will be in Leesburg at the Vine. The volunteers will be there. You don't have to get out of your car, just pull through. The volunteers will put the food in your car. Our EOC is up and running. It's been running for a couple of weeks now. 759-6023 for any questions you have non-emergency wise. 759-6023. We hope to see the trend continue, but to have that trend continue, you all must continue to do your part. Thank you so much.
Thank you, Chairman. Now we will hear from a representative from Phoebe Putnam Memorial Hospital. Dr. James Black is the Medical Director for Emergency Medicine. Dr. Black.
Good afternoon. Our numbers from over the weekend, we ran 473 tests. Of those, 112 were positive, 356 were negative, and we had 5 deaths. Again, these numbers are across the health system, not just for Daugherty County, but all of our hospitals and clinics combined. That brings the total to date to 1,851 positive tests and 3,170 negative tests. We still have 112 pending, and their numbers continue to fall as we found better ways to get the test back more in a faster manner. So our number of pending tests is at 112. We currently have 168 of those that are hospitalized with COVID-19, and the total number of deaths in the hospital system is 64. We have eclipsed the 12,000, we're approaching 13,000 hotline calls since its inception, and our drive-through screenings has now been 2,354. That, along with our telehealth strategies, are other ways we're trying to help with our social distancing by not having people need to get out of the cars and come to appointments and so forth. Again, that number for the screening is 229-312-1919. Thank you.
Thank you, Dr. Black, for your comments and updates today. We will now bring up Daugherty County Coroner, Mr. Michael Fowler, for a presentation on COVID-19. Dr. Fowler. Mr. Fowler.
Good afternoon. I'm gonna do our presentations today. Let me get my PowerPoint. To go over some of the numbers that we have, and sometimes being able to see it is have a more impact of what we are doing. This is just a map of Albany. I'm trying to give you a breakdown of what the individuals that pass in certain location. And the addresses that I have about 39, almost 40 locations. I'm still working on the others. I'm trying to get the presentation ready for this today. In zip code 31721, we have 6 deaths in that area. 31707, we have 9 deaths in that location. On East Albany 31705, we have 11 deaths in that location. In 31701, we have 23 deaths in that location. The gender, we have 56 female, we have 44 males. Race, we have 77% Afro-American, 23% white. Gender broke down, it's 8% white male, 15% white female, 37% black male, 40% black female. The age breakdown, we have 2 individuals in their 30s, we have 6 individuals in their 40s, 2 individuals in their 50s, we have 29 individuals in their 60s, 15 individuals in their 70s, 17 in their 80s, and 8 in their 90s. Their average age is 71. We have a total of 79 deaths for residents here in Dougherty County. And I just got a call, which just before I came up, we got 1 more, so that's really 80. As I heard one of the gentlemen said earlier, 1 is too many. Definitely too many. And I hope you had a great Easter, as the mayor said earlier, and also the chairman. And while I was sitting there reading during Easter, I found this scripture, and I want to bring it out because I'm passionate about what I do, and I'm concerned about the community. Somebody said the coroner don't have to do what he do, but I'm concerned about the community. Somebody got to step outside the box, out their comfort zone, so I said I'll do it. When I was reading Romans the 13th chapter, the 1st and 2nd verse, it said, "Let every soul be subject to the governing authority, for there is no authority except from God, and the authority that exists are appointed by God. Therefore, whoever resists the authority resists the orders of God, and those who resist will bring judgment on themselves." Governor Kemp have issued a statewide shelter-in-place order, and it is prohibiting the gathering of more than 10 people. If social distance of 6 feet or more between people cannot be maintained. 31 days, we have been here preaching the same thing from this podium about social distancing, but it's not working. Why do we need law enforcement to take time out from doing their regular work for crimes that's going on? Why do we need law enforcement to come out to churches, to funerals, to see as we fall into order? That just don't make sense. If we follow the order that Governor Kemp and the Georgia Department of Public Health have set forth, we'll be great. But some are, as the mayor said earlier, some are doing what they're supposed to be doing, but some are not doing what they're supposed to be doing. Over the weekend, I went to numerous houses that people had died with that was positive when I got the test back. I've seen up to 30 individuals at the house don't have masks on. As the chairman just said, most times if that person was positive, automatically the family members in that house probably been contagious too, being a victim, may have the same virus, may not have been tested yet. But then others still want to get to the funeral and hang around and show your condolence. You can show your condolence by making a phone call. 3 weeks ago, I made the statement that I do not want to reach 100. Right now, we are 3/4 of the way there, and it's sad. Jimmy have set up a morgue for me last week, and they finished it up this morning. And I was hoping not to need that morgue, but the way it's going, I'm gonna need that morgue and another morgue. Somebody asked, what you put up here, corner? This is a body bag. I'm just being real. I want you to get the picture and how serious I am about this. I brought this body bag today for you to see. Maybe you'll get the message today. Maybe it may be your loved one. Maybe it may be you that I have to come out and pronounce and use this body bag. So we got to follow the order. Somebody said, that's kind of harsh to say that, Mr. Fowler. Well, it's harsh for a family member to not to go up to MICU or SICU to tell their loved one bye. So that's harsh to me. They got to do a Skype or can't even see their loved one to say bye. So we got to do what's right. We shouldn't have to preach the same thing over and over and over and over again. If you can repeat the same thing over and over again, that means somebody's not getting it. So I'm asking you again, do what is right. If you do what's right, lives will be saved. So in a sense, we have 80 deceased persons that tested positive in Dougherty County resident. Will we make it to 100? We may make it to 100 before the week out. Will it be you? Obey the orders, and then we'll get past this area of life. Again, I hate to be so passionate and upset about it, but I'm tired of going to family houses and 20 and 30 people at the house, nobody got a mask on. Somebody needs to say something, somebody needs to do something. Then you saw the ration, you see where it at. So everybody asks, well, why is it so more prevalent in the black? Why is it, you add the numbers up. So I can say that because I see it. I want you to get the picture today. I don't want to use this body bag. I want to stay in this plastic. So again, I love you. And that's why I'm trying to save lives. That's the only reason I'm up here. Thank you.
Thank you, Mr. Coroner, for your comments and for your presentation today and your passion for this community. Now we will open the floor for any questions at this time. Questions?
I have two.
Yes.
I just want to know if you have a number of how many reports you've had at local nursing homes?
I had that slide in here about the number of nursing home patients and the number of residents and the number of individuals that we had at the hospital. But I took it out because I wanted to make sure, I don't want to make a mistake on that, but we do have quite a few that was in the nursing home that have passed, and also the hospital, but majority of them from the hospital, from the ER, majority of them.
So people have been saying that the National Guard is being used to help at nursing homes, is that true?
Yes, one of the things that we requested was additional physician services, and literally to have the National Guard come in, look at these nursing homes, evaluate their infection protocols, make sure that they're doing the right thing, make sure that these nursing homes are doing the right thing, quarantining the right folks, educating the staff so that there are protocols in place to make sure that they're not cross-contaminating people and further spreading the virus. So yes, that's absolutely true.
Are there any specifics that you can name that they will be at?
I'm sorry?
Any specific nursing homes?
I know that they've already been at Pruitt and one other as well. And in Lee County as well.
Thank you.
Any additional comments? Okay, as we close, let's all remember to continue to stay strong, protect each other and ourselves, and let's all get through this together. It's really important to continue to practice social distancing and follow the orders that we've been given. And remember, if you need a question answered, please don't call 911 unless it's an emergency. call the Emergency Operations Center, 302-1900. If you want to report someone who you believe is in violation of the order, that is the number to call, and we will be sure to review it and get someone out to look at it. With that being said, this concludes our press conference for the day, and we'll see you back here at Wednesday at 1 p.m. Thank you.